Hey guys, this is Dr. Baker. I am responding to a question from one of my followers who is interested in cardiothoracic surgery, and he asked me whether I had already decided that I wanted to be a neurosurgeon. I wasn't entirely sure. I was actually really debating between becoming a cardiothoracic surgeon myself and neurosurgery. There was also interest in plastic surgery and orthopedic surgery, but big differences. I think I'm a tad biased because I'm a neurosurgeon. I love my field and I wouldn't change it for anything. Cardiothoracic surgery is also a pretty long residency training. It's grueling. It's mostly dealing with heart and heart bypass, valve replacements. Some of the cardiothoracic surgeons also do endovascular work. In neurosurgery, on the other hand, it's broad. I mean, you got oncology, neurosurgery, you've got spine, you got pediatric, you got functional neurosurgery, you manage seizures, deep brain stimulator implantations, peripheral nerve surgery, and it's so integrated with overall healthcare. Almost everything touches neurosurgery in some ways or another. And in order to become a neurosurgeon, you have to know pretty much all the other fields to a high degree to be a high caliber neurosurgeon. And I personally feel being a neurosurgeon, you can make a huge impact in a person's life in a dramatic way, in a very quick way also. That could be simply saving life from an epidural hematoma, subdural hematoma, emergent craniotomy, craniectomy, or a patient who has profound loss of function, paralyzed due to an acute injury. You take care of the problem and immediately if the procedure is done right on the right patient, you'll see an immediate response. So I hope that answers the question. So choosing the field, cardiothoracic surgery or neurosurgery, I don't think I would set my mind into one field or another without really being exposed to the different elements of the subspecialty or the specialty. I would just go with an open mind, work really hard, learn as much as you can in medical school to get the full experience of all the fields, or at least the basic knowledge of all the fields, and then dabble in all these different fields by doing small rotations or even volunteer some time with the surgeons so you have a better sense of what your heart's telling you and what you're passionate to do. Hope that answers the question.